All right, so I've gone through my patient's chart, and I have looked at her chief complaint. I have come to the determination that I'm going to perform a head-to-toe assessment on my patient. I've looked at all of her vital signs that were taken, and they're all within normal limits. I've made note of any allergies that I need to be aware of from coming to the outside of the room, and I don't see any isolation precautions or anything like that. I'm going to knock on the door. Hi there, my name is Liz. I'm going to be your nurse for today. Can you tell me your first and last name?
Beth Summers.
And your date of birth?
11/14/83.
Great, and can I confirm that with your wristband? Wonderful. I'm going to perform hand hygiene and provide privacy. So Beth, I'm going to be performing a head-to-toe assessment on you before the doctor comes in to see you, okay? Beth, can you tell me what year it is right now?
2023.
Perfect. And can you tell me why you're here in the hospital today?
Just feeling really tired.
Okay, great. Well, hopefully we can help you feel a little bit better. So I'm gonna test your cranial nerves first and ask you a couple questions, and then we'll listen to a couple things to assess all the different systems, okay? So we're gonna start out with cranial nerve number 1, which is the olfactory, and I'm gonna have you close your eyes. And I'm going to waft something in front of your nose, and I'll just have you tell me what it is. Awesome. I'm going to use this to clean my stethoscope. And then we're going to check cranial nerve 2, 3, 4, and 6, which is the optic, the oculomotor, the trochlear nerve, and your abducens, which is this. So I'm going to shine a light in your eyes, Beth, if you can just pick a point on the back wall there and shine a light. Great. And eyes are perla. So then I'm going to ask you to follow my pen light here without moving your head, just your eyes. We're checking the 6 cardinal gazes, and then I'll check for accommodation, and that all is intact. So next I'm going to check cranial nerves 5 and 7, which is the trigeminal nerve and your facial nerve. I'm going to have my cotton ball here, and I'm going to touch your face at different points with your eyes closed. Just tell me where you feel me touching, okay?
Can you please tell me which area? Left cheek.
Great. And can you pull down your mask and just give me a big smile? Awesome. And puff out your cheeks for me. Can you raise your eyebrows? Great. So next I'm going to check the cranial nerves 9, 10, and 12, which is your glossopharyngeal, your vagus nerve, and your hypoglossal. I'm going to shine a light in your mouth. Just give me a big ah. Perfect. And I can see your uvula is moving up and down. And can you swallow for me? Great. And I can see that her trachea is midline there also. And can you say light, tight, dynamite?
Light, tight, dynamite.
Great. So next I'm going to check cranial nerve 8, which is the vestibular nerve. I'll have you close your eyes again and just tell me where you hear me rubbing my fingers.
Right side. Left side.
Awesome. And then next is the accessory nerve, cranial nerve 12. So I'm going to push against your face and just push right back at me. Just give your shoulders a shrug. Perfect. And then I'm going to check your upper extremity strength here. Just bend your elbows and pull against me and push. Great. Can you wiggle your fingers and give my fingers a squeeze? Perfect. And can you touch each finger here, checking for good
and lower
coordination. Thank you, that's good. I'm gonna check your skin temperature here. Skin temperature and color is even overall, appropriate for race. Work of breathing is normal. She doesn't seem to be in any distress. There's no diaphoresis or anything like that. So next we're gonna move on to your cardiovascular. So I'm going to expose your chest. Looking overall, skin color is normal. I don't see any abnormalities in your skin, no lesions or anything like that. I'm going to palpate, so take a big deep breath in. Perfect. And chest rises and falls normally. I'm going to auscultate for heart sounds. And we're going to start heart sounds on your right sternal border. Listening for your aortic valve at the second intercostal space. And then moving over to the left sternal border, second intercostal space for the pulmonic valve. Moving down to the third intercostal space, your left sternal border for Erb's point. And then fourth intercostal space, left sternal border is the tricuspid valve. And then if you can displace your breast tissue, we're going to listen at the fifth intercostal space, the midclavicular line for the mitral valve, which is the point of maximum impulse. And all of your heart sounds are normal. So that was listening for S1 and S2 sounds with my diaphragm. And I'm going to go back and listen with my bell of my stethoscope in all of those 5 spots for S3 and S4 sounds, which would be abnormal, and those are not present, so that's great. So now we're going to listen for your lung sounds, and we're going to start at your first intercostal space on the left side, and we're going to alternate sides so that I can compare bilaterally your lung sounds. So we'll start at the first intercostal space, your right side here, midclavicular line. And each time you feel my stethoscope on your skin, just take a big deep breath in and out. And then your left side, first intercostal space, midclavicular line. Moving down to the second intercostal space, midclavicular line on both sides. And then your fourth intercostal space, midclavicular line on both sides. And then the sixth intercostal space, just lateral to the nipple on both sides. And I'm going to check the sixth intercostal space on your anterior axillary line on both sides. And then the eighth intercostal space between the midclavicular line and your anterior axillary line on both sides. Alright, and lung sounds are all clear bilaterally. Are you having any shortness of breath? Are you experiencing any chest pain or anything like that? Do you have any respiratory history, like asthma or COPD or anything like that? Nope. Okay. I'm going to check your capillary refill and your upper extremities here. And those are all less than 2 seconds. So then we're going to go down to your abdomen. Are you having any pain in your abdomen at all? Okay. And are you having normal bowel movements and no pain? Great. Good. Okay, so then we're going to visualize your abdomen, contour is normal. There's no distension or anything like that. No skin lesions. Skin color is even overall. So since there's no pain, we can start auscultating at the this is the right lower quadrant where the ileocecal valve is. And I listen for 10 to 15 seconds, and then move up to the right upper quadrant, the left upper quadrant, and then the left lower quadrant. And bowel tones are all present, which is great. So then I'm going to palpate, starting at the right lower quadrant. Tell me if you feel any pain. Okay, using my hula hands, over. Any pain present there? Okay, then I'll do deep palpation, testing for rebound tenderness. Any pain there? Any pain there? Okay, great. And I'm going to test for strength on your lower extremities here. Can you just lift your leg there? Perfect. And there. Great. And are you having normal menstrual cycles? And any painful urinations or urgencies to urinate there? Okay, great. Lower extremities, I don't see any edema. Skin color is normal. No skin breakdown or anything like that. I'm going to check for capillary refill on your toes. And those are all less than 2 seconds. Can you wiggle your toes for me? Perfect. I'll push against my toes there, or my fingers, and pull. Great. And I'm going to check for your reflex here on this foot. Okay, great. All right. Oh no, can you pull down your sclera for me? I'm just going to check your mucus membranes are pink and wet. That's great. All normal. Okay, I'm going to have you sit up on the edge of the bed there, and we're going to auscultate lung sounds on your back. First I'm going to visualize, and I'm going to see that her spine is midline, there's no skin breakdown or ulcers on her sacrum or coccyx. Can you take a big deep breath in for me? And her lung expansion is even on both sides. So then I'm going to auscultate for breath sounds or lung sounds, starting at C7, 3 inches to the left and right, moving down in a ladder-like formation, a couple inches apart, fanning out to end at her 8th intercostal space, the posterior axial. And every time you feel my stethoscope, just take a breath in and out. Yes. Perfect. The lung sounds are all even clear bilaterally. Okay, so next I'm going to check your gait and balance. So Beth, can you stand up for me? Are you experiencing any dizziness or nausea or anything like that? Go ahead and close your eyes. We'll perform the Rombrick's test. Great. That is normal. So then I'll have you take a couple steps heel to toe, just to about here. Perfect. Turn around. And we'll go back to the bed. And I visualize the posterior of her legs. There's no skin breakdown or ulcers on her heels. So I am done performing your head to toe assessment. Is there anything that I can get for you before the doctor comes in?
Just a warm blanket.
Warm blanket, great. So I'm going to make sure that she's in a position of comfort, the bed is low and locked, and your call light is within reach. I'm going to perform hand hygiene, and then go document my findings. There's